Hello, everyone. In our project for this course, we'll be exploring aspects of a recurring multicultural issue called language barriers. So let's get started. Language barriers in counseling can significantly impact the therapeutic process, making it difficult for clients and counselors to communicate effectively. These barriers can arise due to differences in language, cultural norms, and communication styles. We have some bullet points here that are related to our issue that may occur in a typical session regarding language barriers. When a client is not fluent in a language like English used by the counselor, the client or student may struggle to fully express their thoughts, emotions, or concerns. This can limit the depth of the therapeutic conversation overall, which may prevent them from articulating their experiences or feelings clearly. In some cultures, certain words or phrases may have different meanings or emotional impacts. A counselor may unintentionally use a specific type of communication that is inappropriate or disrespectful in the client's culture, which could harm the therapeutic relationship. Verbal and nonverbal communication should be considered, like facial expressions, low/high contacts, tone of voice, and body gestures. What might be a common way of expressing empathy or understanding in one culture could be perceived as something different than what we intended to be. Stigma on mental health or emotional restraints in some cultures. How this can tie to language barriers is that people can often be conflicting in two different sides. One side is stigma of receiving mental health, and the other is getting help that they may need to those emotions, often sometimes clashing with each other, which can lead to not fully understanding what the counselor is trying to help with, often being resistant and conflicted. Clients who feel that they may not be understood due to language barriers or differences might avoid sharing important aspects of their lives or struggles. They might also fear being judged or misunderstood by the counselor, which can hinder progress in therapy. Addressing language barriers in counseling requires an understanding of the client's background and cultural ethnicity. This issue can be seen in many areas of counseling. All experiences unique from one another. However, I would say in our next slide, I'll be also going over some goals and desired outcomes for addressing this issue. So goals and desired outcomes for language barriers. When addressing language barriers in counseling, the desired outcomes focus on ensuring that communication remains effective, respectful, and supportive of the client's mental health needs. These outcomes are aimed at enhancing the relationship between the counselor and the client. The overall outcome should have an environment in which he or she is heard and empowered. Here are some key desired outcomes down below in the slide. So the goal is to ensure that both the counselor and the client can communicate their thoughts, feelings, and concerns without misinterpretation or any other confusion. Hopefully the outcome can be the counselor should accurately understand the client's issues, concerns, and other emotions. This may involve the use of easy to understand language like simple terms, hopefully avoiding any slang or other jargon. So to be multicultural competent, the counselor needs to be sensitive to the client's cultural context, language, and communication style. Doing research beforehand, a session occurs by understanding the person's background is also suggested. An outcome, the counselor should demonstrate awareness of how cultural differences may impact communication and be able to adapt their approach accordingly. This includes being mindful of nonverbal and verbal communication throughout. The client should be respected and understood in their culture in linguistic context through any background. Goal is to foster the environment in which the client feels engaged in the counseling process, contributing actively to discussions and therapy goals, to create an environment in which language differences do not affect the emotional healing process. The client can express and process their emotions effectively with ease. Outcome, hopefully, the clients should feel involved and active in the therapy sessions by expressing their views, concerns, and progress despite the language differences. This leads to a better engagement and a stronger therapeutic chemistry among both sides. By overcoming language barriers, clients should feel they have the emotional and psychological support they need, enabling them to make progress in therapy, work through their challenges, and achieve healing overall. Lastly, our last goal, using speech interpreters or other technology translation apps may be a great way for effective communication between both sides. The downside is the flow or the fluidity of the sessions, which may not feel as empathetic than regular verbal communication. Hopefully, the outcome, if necessary, professional interpreters should be used to ensure accurate communication in a way that supports the client's understanding and comfort. The outcome is that these resources are used seamlessly without disrupting the therapeutic process. However, it might feel empathetic in some cases. In summary, the desired outcomes for addressing language barriers in counseling revolve around achieving effective communication, trust, knowing cultural identities, and providing an environment in which clients feel empowered to express, to be themselves. By overcoming language barriers, counselors can provide more effective and inclusive support for their clients, reaching specific groundbreaking milestones, and hopefully through more of a natural process.
Okay, I will be talking about the assessment, critique, and evaluation of current approaches to language barriers in counseling. Well, verbal and nonverbal language barriers can be a major obstacle in mental health services. The issues go beyond literal translation and can include misinterpreting nonverbal cues or cultural norms that impact therapeutic communication. Each approach below will address barriers through institutional, cultural, social, and physical dimensions. So, interpreter and translation services, they use professional interpreters to facilitate communication when the counselor and client do not share a language. In the institutional dimension, interpreter services can be common, particularly in hospitals and public clinics. They can often be reactive as opposed to proactively integrated into a care model. Availability can also be inconsistent, especially for Indigenous languages or dialects that are common among refugees. In cultural dimension, literal translation can fail to capture meaning in higher context cultures, such as among Arab Americans or Asian Americans that utilize nonverbal cues, indirect language, or metaphor more commonly. If the interpreter doesn't have cultural training, they can miss these subtleties, which can lead to miscommunication. In the social dimension, an interpreter can disrupt the therapeutic relationship. Clients that come from collectivist or trauma impacted communities might feel unsafe sharing their personal information through a third party, especially if the interpreter is from the same small cultural community. In the physical dimension, the logistics of using an interpreter can have delays, technology issues in a virtual setting, or lack of physical space for a third party during a session can create discomfort and may make the client unwilling to return. Moving on to multicultural competence training for counselors. This training allows mental health professionals to understand, respect, and then adapt to the cultural backgrounds of diverse clients. In the institutional dimension, cultural competence training is required by most counseling programs, but the consistency can vary widely. Many institutions emphasize a surface level knowledge, like holidays or customs, rather than a deeper training in communication styles or underlying bias. In the cultural dimension, training can generalize cultural groups and fail to distinguish within group differences. For example, distinguish between different native tribes or different Arab ethnicities. It can also tend to focus on Western communication norms, which can leave counselors underprepared for high context or indirect styles. In the social dimension, when done well, training can increase empathy and cultural humility, which is great, but it rarely addresses systemic issues that are rooted in historical trauma. For example, boarding schools for Native Americans or the post 9/11 surveillance of Muslim communities, which continue to affect the client counselor dynamic. In the physical dimension, training focuses on counselor knowledge, but it often ignores how the physical environment can impact communication. For instance, therapy offices may lack visual cues like cultural symbols or accessible language signage that help clients feel more welcome. In this last approach of culturally adapted therapy models, traditional therapy approaches are modified to align with cultural beliefs, communication styles, and worldviews of specific populations. In the institutional dimension, these models are in some community-based organizations, but have not been widely adopted to mainstream institutions. An example of this would be using indigenous storytelling methods or incorporating Islamic values into therapy. In the cultural dimension, culturally adapted models acknowledge and incorporate clients' worldviews, including nonverbal norms, family roles, and spiritual frameworks. This helps bridge cultural gaps in communication. In the social dimension, aligning therapy with cultural values can reduce stigma and build trust. For immigrants and refugees, models that validate cultural loss and include family or community can help address deeper relational dynamics that are missed in many Western approaches. In the physical dimension, culturally adapted models sometimes move therapy out of traditional office settings to make therapy more physically and emotionally accessible. These can be homes, community centers, or nature-based settings. However, lack of funding or institutional support can limit these options. So in conclusion, as you can see, all these approaches are promising, but also offer limitations across the institutional, cultural, social, and physical dimensions. Okay, next slide. We will move right along to necessary proactive steps and alternatives to affect the desired outcomes. Just a reminder, our desired outcomes are to create clear and fluid communication between counselor and client, improve counselors' understanding and empathy of other cultures, enhance client participation and engagement, and incorporate resources seamlessly into counseling sessions. Cultural and linguistic preparation before sessions can support our creating clear and fluid communication and improving counselors' understanding and empathy of other cultures' outcomes. Counselors should proactively prepare by researching the client's cultural background and preferred communication styles. If they are unfamiliar, they should consult colleagues or other resources to gain insight into specific cultural norms. This can help prevent overly complex or culturally inappropriate language, ultimately fostering mutual trust and understanding. Use of interpreters and language technology is the next proactive step. While interpreters and translation tools are essential to bridge language gaps, they have to be used thoughtfully. Counselors should research and choose tools that are accurate and also minimally disruptive to the session's flow. If possible, the same interpreter should be used consistently to build rapport and help the client want to return. This proactive step can arguably address all of our outcomes. Creating an emotionally supportive, client-centered environment addresses our outcome, enhance client participation and engagement. To do this, counselors should adopt simple and relatable counseling methods that align with the client's communication preferences. These can be verbal or nonverbal and can include active listening, validating feelings, and encouraging clients to express emotions in ways that feel natural to them. By being empathetic and responsive, counselors can create a space where language or cultural differences do not hinder emotional healing. Okay, the next slide is expected resistance when working towards desired outcomes. When working towards the create clear and fluid communication between counselor and client and enhance client participation and engagement outcomes, some clients or counselors may resist using interpreters or translation tools. This can be because of concerns about confidentiality, a loss in personal connection, or a possible disrupted session flow. Counselors might feel that these tools interfere with building rapport, while clients may feel uncomfortable sharing sensitive information in the presence of a third party or through a device. For example, a counselor may think that relying on an interpreter will create a barrier, which may prompt them to try and navigate the conversation without assistance, which risks miscommunication during the session. When working towards the improved counselor's understanding and empathy of other cultures and enhance client participation and engagement outcomes, it's important to realize that even well-meaning professionals may carry unconscious bias or struggle to grasp the cultural norms of a client, especially if they're under some kind of time constraint. Resistance may come in the form of minimizing the importance of cultural context or relying on their stereotype rather than doing the needed background research or seeking guidance from colleagues. For example, a counselor unfamiliar with high context communication styles could misinterpret a client's more reserved behavior as disinterested, when in reality, it's actually the client's culturally appropriate form of respect.
Okay, the next section that we'll be speaking about is advocacy related to the desired outcomes, and we're going to focus on the 6 advocacy competencies. The first level of the advocacy competencies is the client-student empowerment. The counselor must identify the language strengths of their clients and train them in self-advocacy skills. The counselor will also encourage the client to identify barriers that may be affecting their ability to communicate. And then in turn, ideally, the outcome is that the client will be able to advocate for themselves and their communication abilities. The next level in advocacy competencies is the client-student advocacy. And this is where the counselor advocates for their client. They do this by helping them gain access to needed resources. This could be translators, technology resources, etc. And if these services are unavailable or difficult to attain, the counselor will identify potential allies for confronting these barriers to ensure the client is advocated for. So first we have the client empowerment, then the counselor advocating for the client. And the third advocacy competency is community collaboration. And this is where the counselor alerts the community and school groups of the language barriers that may be in the community. And the counselor will also communicate resources that are available to ensure that there is communicated recognition for these groups and resources. So first you start with the client and then the client advocacy, and then you work on getting the whole community involved to address these issues and advocate. The next level of the advocacy competencies is the systems advocacy. And this is where the counselor will identify systemic factors that act as barriers to ensuring equitable access to language resources. So the counselor will provide and interpret data regarding language barrier issues in the community, and the counselor must also develop a plan for dealing with these issues to ensure resources are being accessed. And to continue getting the public involved, which is necessary when you're advocating for a client, the next level is public information. And this is when the counselor ensures the public is aware of the systemic issues surrounding language barriers and how they're being addressed. And this can look like a variety of different ways, but they could use brochures or they could pass out pamphlets in the community, sharing information through a variety of social media, websites, television ads, etc., or working with professionals who are well-versed in sharing information with the public. And then finally, the last level of advocacy is the social political advocacy. And this is the final and the largest level of advocacy as it reaches a wide range of people. It's at a larger nationwide level. And this is where the counselor and community allies will continue to advocate for accessible language resources. And this can be through allies, lobby legislators, and policymakers. So the next couple slides are regarding counseling implications in different settings. The first setting is school counseling implications. So students who do not speak the majority language may feel misunderstood or disconnected from their peers or their school counselor. Counselors and teachers may also misinterpret behaviors or emotions as defiance rather than the student's inability to fully understand the expectations due to a language barrier. And it's possible that students with a language barrier may not receive the same support as their other peers, and they may have limited access to the resources they need. So in order to combat these issues, counselors must advocate for these marginalized students. They must assist in multicultural competency training for other staff in the building. And it's critical that all staff working with these groups understand how to support these students and their families. So it's not only important that the counselor is trained in multicultural competency, but also the teachers that are working with these students. The second implication is within the family counseling setting. It's possible that a counselor may be counseling different family members that speak different languages. So, for example, the child may speak English if they were born in the United States, but their parents may only speak their native language. And this may result in difficulty communicating with all family members at once in a group setting, which could also result in power imbalances, mistrust of the counselor, and inability to understand the presenting problems, what is bringing the family to counseling. In order to combat these issues, it's critical that the counselor is competent in multicultural counseling techniques in order to sufficiently counsel the entire family. The counselor is always encouraged to acquire a professional translator for the sessions. It's not good practice to rely on the child to translate for the rest of the family. And the counselor must also pay attention to nonverbal cues, especially those in high context individuals. And the final setting is within the clinical mental health counseling setting. Language barriers between the counselor and client may result in a weak counselor-client alliance. And if the counselor is not trained in multicultural counseling techniques, it is very possible that the client may feel misunderstood or judged by their counselor. It's critical that the counselor fully understands the verbal and nonverbal cues of different cultures. And if these are ignored or not understood, this can result in major disconnects that will negatively impact the counseling sessions. So implications of these issues, counselors must consider the background of these diverse individuals. It's critical that the counselor understands how language barriers may affect the ability of their client to share their emotions and presenting problems. It's possible that a counselor may feel like a client is unwilling to share, when in reality, they may be struggling to fully understand what the counselor is asking, or the counselor is not picking up on what they're sharing through their nonverbal cues. And not only must the counselor be culturally competent, but they must seek out a professional translator if necessary. The next few slides are addressing these language barriers with four cultural groups that we studied in the course. So the first is addressing language barriers with Asian Americans. Verbally, they believe that strong emotional displays are considered signs of immaturity, and being able to control their emotions is a sign of strength. So this is possible that they may be less willing to share due to this. And if a counselor is not aware of these differences, they may think the individual is being difficult or unwilling to share, when in reality, this is how their culture views mental health and sharing their emotions. And then some nonverbal cues. Asian Americans are high context individuals, which means they lean towards and rely on nonverbal cues to share how they're feeling, and they may show how they're feeling through posture, etiquette, proximity, how close they're sitting to the counselor, etc. And so some implications of these verbal and nonverbal cues is that when counseling Asian Americans, it is critical to understand these communication differences. The counselor must not only understand the nonverbal cues of their client, but also the nonverbal cues that they are sharing that is being interpreted by the client. So they must pay attention to how the client is acting and understand that everything that they're showing nonverbally, the client is also perceiving. The second group that we chose for this project is Native Americans. Verbally, there is a strong pride in the tribe and historical backgrounds of Native Americans, which means that many Native Americans, especially elders, prefer to speak in their native language. And sometimes this can result in being misunderstood by the counselor or an inability to share their presenting problems. And many Native Americans are not overly emotional and they choose to not share their emotions, similarly to Asian Americans. They are also high context individuals and they rely heavily on nonverbal cues and unspoken understanding. They will not use explicit language to share how they are feeling. So, implications when counseling Native Americans. The counselor must understand these characteristics about this group. They must work to understand the nonverbal cues and what they are trying to share with the counselor. And the counselor must not make assumptions based on an individual's inability to share, but rather consider the cultural implications. The next group is Arab Americans and Muslims. Arab Americans are less likely to share emotions and be overly emotional, and because of this, they may struggle to share complex emotions. And these struggles, paired with the stigma around mental health that is seen in this group, may result in the counselor having difficulty understanding the presenting problems that the client is facing. Similarly to the last two groups, Arab Americans are also high context individuals. They rely more on context rather than content. So they're less concerned about the literal meaning of something, but rather how it is said. So nonverbal cues are extremely important within this cultural group. Again, counselors must understand these characteristics about Arab Americans and Muslims. Counselors must pay attention to nonverbal cues and context rather than what the client is saying. And failure to do this may result in miscommunications and ineffective counseling sessions. And then our last group is immigrants and refugees. Refugees and immigrants may have trauma or PTSD that is not easily shared within their native language to their counselor, and this may result in misunderstandings, miscommunications, or frustrations. And it's very possible that a refugee or immigrant may be less willing to open up to their counselor due to mistrust and fear, especially if they're leaving their country because it was unsafe or they're trying to escape something. A refugee or immigrant can be high context or low context, depending on where they're from. So, a high context refugee or immigrant will rely on nonverbal cues and how the counselor is saying things versus what is said. And in contrast, a low context individual will be direct and clear about what they are saying. So, what that means is that high context individuals will use nonverbal cues, while low context individuals will be explicit with their words. And implications of this when counseling immigrants and refugees, the counselor must understand and research or ask for help if necessary, the background of the immigrant or refugee they are counseling. And it's critical that they understand if they are working with a high context or low context individual, as this will ultimately change the way they counsel their client and the techniques they use. This next page is our references. So it's this slide and this slide. And that's all we have for today. Thank you for listening to our presentation about language barriers.